Hi, this is Dr. Kang of Dr. Kang's Scuba Diving Stories. And the other day I remember having talked about pregnancy and diving. And today I want to give a little bit of mention on children and diving. Children and diving, to talk about this, we need to understand what a child is and compare it to adult, what is different. And then we will talk about the concern. The main concern is not physical. It's more about the psychological. So about child and adult, it's very important that we remember that a child is not a small adult. A child is still growing, it's maturing, and tissues are still evolving. It's the true with physical and mental issue as well. The organs in our body have a little different, they need a little different time to be mature. I mean, adult mature. For example, the septum of nose, we wait until the age of 15 because we believe it is all grown, so we can do the operation. Auricle, we wait a little longer than that. So child have different steps that they take to grow up to an adult. So the influence of these small microbubble to a growing tissue, it's not yet proven. And it's not proven to be completely safe to have bubbles in a little baby's growing tissues. So also children, when we talk about diving, we talk about the equalization, and we also talk about the eustachian tube. I think I gave you the presentation on those subjects already. And children's eustachian tube is more of horizontal compared to adults eustachian tube, which is a little diagonal, which means because it is horizontal, you have infection in your nose that goes pretty easily into the middle ear. So middle ear effusion or middle ear infection is more common in children, which is certainly a risk for middle ear paratrauma. Children's burns a lot more calories than adults. They produce heat, so they are kind of more tolerant to cold at the beginning, but when that calorie all burns out, they become relatively prone to hypothermia. Pretty interesting physiological difference. Also, children have a little different body mass index, which is they have relatively high body mass to surface area ratio, which accelerates the heat loss. Children have more asthma than adults, which is a very big problem for most parents. But still, some of them are hidden. Some of them are very well shown, very seen by adults. But if they have some episode of asthma, it decreases pulmonary function, sometimes very badly. When they have active asthma, they cannot dive, of course. But if you have history of asthma, you need to be very, very cautious when you take a little kid to diving. Because if they get asthmatic attack underwater, you don't like to see that. Also, diving is not a solo activity, it's a buddy activity. So a buddy should be mature, strong enough to help buddy. But it's not always the case. So if you do not know the baby, you wouldn't like to buddy up with the baby. So also the children have a much poor ability to cope with something unexpected or unpredictable. They may show actions which is unpredictable and unexpected. They are more distracted than adults. They are everywhere. Their thinking is not stagnant. So this means they cannot adhere to the dive plan. For example, I have a son who's a pilot now. I taught him scuba when he was like 13. I took him to Boracay Beach, Philippines, and we finished our open water training dive. And by the end of the trip, he was on the water, pretty shallow, but I showed him my computer. I told him it's been 60 minutes already, and I signed thumb up. And he goes, and then he ran away. I couldn't really follow him. He was very fast. He was a child. But that can happen to any child. They do not really follow or understand what they really have to do. And for this, so while, but still, there's some good things about children as well. They learn physical skills very easily, for sure. Yeah. When I was teaching my daughter and my son, for example, I teach them how to clear the mask. And what they do is boop, boop, and then he stretch out his hand to shake my hand. Maybe they were very familiar with diving already because we have been doing it for many years. But still, they learn very easily and very quickly. They have surprisingly good water skills. Also, they have a pretty good stamina. No problem with swimming if you teach them. And also, they can do the survivor swim for 10-15 minutes, no problem. Also, diving fatalities. It doesn't show any difference compared to the adult. Probably it's because there are not so many children diving, and also adult buddies take very good care of them. So when a child dives, buddy should be an adult. We should never let children dive together. No. A buddy should be well aware of the children's status, how strong he is, how confident he is, and how well physically and mentally prepared. A buddy should check. So also a buddy should lead and make the child participate in all diving procedure, including planning, entry, exit, and post-diving wrap-up as well. So usually parents are the best buddies. And it was children and diving issue, and the most biggest concern is their psychological part, not physical part, once they are over like 10. So now in almost all scuba diving training agencies, they teach 10 years older as a junior open water diver. They let kids over 8 to go for some experience programs. And I hope you and your children have a big fun in diving and find whatever you are looking for, like I did long time ago. Thank you very much. There was a children and diving issue, and hopefully I will see you very soon again.